The inception meeting, which brought in a handful of stakeholders including religious, cultural, civil and the youth together to deliberate on the program and give it the much needed support to run within the district. Honorable Isadru Peter, the district youth chairman Moyo district during the meeting said the youth in the district tend to always shy away from receiving family planning services coupled with the lack of information about sexual and reproductive health rights, which has made things even more worse. He therefore requests the implementing partners to work together with the youth leaders in the district so as to disseminate the information about sexual and reproductive health rights among the youths in the district.
My youths are a bit shy in accessing these services. Another thing is information gap. These youth-friendly services are there, but now, who is to tell to the youth? Most of us, sometimes these organizations come like that, but now my request is, let us go deep at the grassroots level. We, the leaders, we are here, but it's a bit challenging sometimes for us to go down sometimes to tell this. With the youth leaders, we have that capacity, we can go in the communities and tell. But we felt that our effort is not still enough. To have community barazas good enough, you people are now, you have targeted schools. We move in schools with you and we see how this information will be disseminated.
Mr. Ameko Jimmy, the District Community Development Officer Moyo said the district lacks shelter for accommodating young offenders in the district and request well-wishers to come to their aid and facilitate the movement of the young offenders and the officers so as to allow the juvenile justice to take its course, saying the district always finds a lot of challenges in transporting the juvenile to the remand homes in Arua due to lack of finance and transport facilities in the district.
Districts do not have holding centers or shelters where you can be able to keep the children as their cases proceed within the districts. So we are requesting for partners who can come in to support government to see how we can be able to support those gaps, putting up shelters, maybe at the police for juvenile or children in conflict with the law, and also supporting the office of the probation officers.
Mr. Ireku George Mbaya, the district planner, said the water component has been left out in the Strengthening Adolescent Youth program, which he feels needs to be added so as to promote good menstrual health and hygiene among the girls while receiving the services in schools and health facilities.
There's one thing that we have missed out, the component of water and sanitation in sexual reproductive health rights. I think it's very critical, especially when you look at the target areas that we are looking at, the school environment. I would love that the element of water and sanitation is incorporated so that when these girls are in the period of menstrual period, the issue of hygiene is equally addressed. I see that one missing in this.
Mr. Bakas Solomon, a retired pastor and the chairman Public Accounts Committee Moyo District, said there is division among the parents on family planning services, with educated parents supporting the service while uneducated parents don't support, adding that there are many youths who are still green about the sexual and reproductive health rights in the villages and wonders how those youths can be helped so as to embrace the program.
The other parents who are positive, I think those who are a bit educated. But those ones who are doomed like me, I don't know whether they understand what family planning means. And they don't allow their children. 1. 2, we have uneducated young girls and young boys who are resting in the village. How do we help them to come up about the issue of family planning? Otherwise, we are sensing danger down that side.
The Strengthening Adolescent Youth and Rights Empowerment Program is a 4-year project which started in January this year and is expected to close in December 2027, is intended to respond to the increasing sexual reproductive health and rights needs among the refugees and host young people in West Nile and Acholi sub-region. The program will be implemented by the Ministry of Health in partnership with the Ministry of Education and Sports and Ministry of Gender, Labour and Social Development, among others, with funding from the Royal Danish Embassy. I'm Dominic Anthony Okumu for West Nile TV, Nilecast.